this video, I'm going to talk about how to avoid overfilled or duck lips and also how to avoid filler migration, because this is an issue I'm seeing more and more commonly in clinic, but also on social media and just generally walking around in London in particular or on the tube. So it's something that most of us are spotting in quite random places. And for me, certainly it's not a look that I find attractive. And it's also not a look that I like to see on patients, because for me it epitomises everything that's wrong with medical aesthetics. So when you end up with overfilled lips, it can happen for a variety of reasons. First of all, it can be that you're having too much product injected and also the wrong type of product. So the lips are very mobile. I'm moving them all the time when I'm talking to you or when I'm eating or when I'm smiling, and also quite thin, delicate skin over the top. If you have a stiff product in that area, you're not going to be able to move properly and it's not going to look nice or look right, and your lips will look distorted. Equally, if you have too much product, it's going to affect how your lips move and how you animate. Both of these causes can lead to it looking overdone. But a big problem I find is something called perception drift, and this can happen in both the patient and the injector. And this is where you very quickly get used to the new you. So you might see your lips immediately and love them, but a couple of weeks later you're thinking, oh my gosh, they're back to where they started. Now, they're not, but you look at your face every day and you just think they are. You also read that fillers in the lips might last anywhere from 5 months onwards. And so you think, oh, I should get my lip filler redone every 5 or 6 months. Now, if you do that, you will end up overfilled, because modern products often hang around for a really long time. And although there is individual variability, if you go and have the same treatment repeated, even if it's only a half mil every 5 or 6 months, you are going to end up with product accumulation, and that can again lead to you looking overfilled. And unfortunately, the same perception drift can also happen in injectors. So injectors can stop losing sight of what's normal and what's natural and create these unnatural results, which is a really sad thing to see. Migration actually happens for exactly the same reasons: wrong product choice, too much product, so it forces it beyond the edge of the lip, and also there are certain technical things that can lead to filler migration. In particular, this is disruption of the vermilion border. And once upon a time, we used to fill this a lot, but now we know that actually it's quite possible to disrupt that in a way that means product just leaks back up into the white lip, leading to this sort of shelfy look where you can see the edge of migrated filler around the mouth. I'd love to say to you that if you are having doubts and you think you may have gone too far, just stop having filler for a while and it will all get back to normal. It might, but it will probably take a really long time. If you've had quite a lot of filler and you've had filler over a prolonged period, this filler won't go away in a hurry if you just leave it to its own devices. And realistically, you should be in the hands of someone who is experienced at dissolving fillers. We have to understand that dissolving is a procedure we should have in our back pocket for when it's really needed, rather than doing willy-nilly. It comes with its own risks. For example, it can remove more or less product than we might want it to, and so you may end up needing multiple sessions of dissolving, or you might have just one session but it removes a lot more of the volume than you anticipated it would, so it's a little bit less predictable. There is also an allergic risk, and it's a prescription medication, so this is 100% a treatment that should be being done by a medical practitioner, as I believe all of these treatments should be. If you are considering whether or not you have overfilled lips or you have lip filler migration, it's something that you can ask your doctor or your nurse about. Don't be afraid to have an honest conversation. And sometimes these have been done by good injectors, but over time the product has ended up spreading, and it is relatively easily treatable, provided you understand the journey that you will go on with dissolving, and that's an important one. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.